Before I introduce Lee Cameron for his presentation, I would like to show one slide right here with regards to medical benefits and give a little background. Last year, the City Council requested staff to prepare a benefit survey of similar municipalities. The survey presented to Council has been updated with current information from last year. I don't think it changed much, but I want to show the point here. Like last year, I think it's roughly 35, give or take, cities. First, you got the city employee. Most cities obviously fund the employee, Fluker being at 100%. And then there's varying dependent coverage from 0 all the way up to, I don't know what the biggest, probably 75 there for one range of employees. And we are at 50. I don't think we're right there. So we're at 50. So this just gives you the range, and it has not changed much from last year. To show you the compensation or contributions for medical. Okay, the city's current medical insurance plan is with Blue Cross Blue Shield of Texas and expires on September 30th, 2013. The city's benefit consultant, Lee Cameron with Ross Insurance, began the annual renewal discussion with Blue Cross Blue Shield in early July. The initial quote from Blue Cross Blue Shield was an increase of 20% for our current plan, plus an additional 4% for fees associated with the Affordable Care Act or Obamacare. That will be effective January 1, 2014. Since this initial quote was unacceptably high, staff decided to take proposals from other insurance companies for competitive quotes. Proposals were received from Aetna, Scott & White, and United Healthcare. After competitive quotes were received from other carriers, Mr. Cameron related the information back to Blue Cross Blue Shield. As a result, Blue Cross Blue Shield revised their renewal on the current plan to an increase of 10%, not including the ACA fees. The city manager and finance director met with Lee on August 19th to go over all the latest information mentioned above, and quite a bit more. As you can imagine, this is a weighty matter. In years past, the city has always offered the employees one plan, and a very generous one at that. However, this year staff believes that there is some merit in offering 3 plans, with one plan being the base plan that the city agrees to fund, another that employees can buy up to, paying the difference. Obviously a little more benefits to the employee there, but they'll be paying for that. And additionally, staff would like council to consider offering a high deductible health plan in order for employees to put money into a health savings account. These accounts are personal savings accounts that can be used to pay for medical, dental, and vision expenses. Last Friday, August 23rd, the monthly employee safety meeting was dedicated to Lee giving an educational presentation on the HSA, health savings account option, to all available employees as it is the least understood plan. It was an informative first step in properly educating the employees. Afterward, I met with available department heads to describe more thoroughly the 3-plan concept just mentioned that Lee will expand on. Now that I have thoroughly confused everyone, I will turn it over to our expert, Lee Cameron, Senior Vice President of Frost Insurance, the city's health insurance broker, to set the record straight.
Thank you, Stan. Good morning, Mayor and council members. Thank you all for having me out here today. I really appreciate it. Appreciate working with Stan and Julie and Lynette and all the exciting times that are happening with healthcare reform. It's going to be an exciting time probably for the next 3 to 5 years, and we'll all get through it. So, but just to back up, just so you know where we are today, this is our single plan design. And when I was brought in last July working on this, we felt like, if we could get a renewal from Blue Cross Blue Shield last year that gave us a rate pass, and that's what we ended up negotiating with the rate pass with Blue Cross Blue Shield last year. So there was no rate increase going into October 1st, 2012. We stayed with the same plan that we're on, and the city continued to make 100% premium contributions on the employee only and 50% on the dependents. And all y'all have those brown folders, and what's in those brown folders is really backup to what is on these slides. And probably the easiest thing to do is under the second tab, the third page back is where you're going to find most of the information. That is, and we couldn't show that slide, that spreadsheet up here by itself because there's just too much information and nobody in this room would be able to see it. So we broke it down and went through all this information. But just to show you, this is the current plan and where the premiums are being paid right now. And you can see on the total monthly premium here, what is being paid in total. Out of that, what the city of Horseshoe Bay is paying per employee, whether you're employee only, employee plus spouse, employee plus children, and then employee plus family. That is the current premium that's being paid on a monthly basis. And then this is the employee share of the premium. You can see on the employee only, they're not paying anything. And then they're paying 50% of the premium here, which comes out to their payroll deductions are right here. And those are on your page. And then so when we went to the market, we received the renewal from Blue Cross Blue Shield, and we were hoping it wasn't going to be a 20.5% renewal, but it was really justified. Our actuary actually went through, plugged it into our Frost Analytics system, and it said that when it came back, it said the renewal should have been somewhere between 17 to 21%. And so that was our initial ploy. We were hoping that we would be able to, our analytics would say something a lot lower than what Blue Cross Blue Shield said. And Blue Cross Blue Shield initially said, okay, well, we can come off these rates about 2%. And I said, well, that's not going to be good enough. We're going to have to take this to the marketplace. And so we took it to the marketplace, and the marketplace pretty much justified where Blue Cross Blue Shield was coming in. And you can see even Cigna and Humana both declined to quote because they couldn't be competitive with the renewal from Blue Cross Blue Shield. And what they saw at that point was 20.5%. And Aetna was there at 15.4, and United Healthcare came in at 12.3. And so what we did is Scott and White came in at 4.3% above current. And that's trying to match as close as we could to the current plan, to that 90% co-insurance plan. They had a 580% plan, and we'll see that in just a minute, that they came in 4.3% higher. And so we used that renewal, that quote alone to go back to Blue Cross Blue Shield, because we didn't want to show them something that was not where we wanted to be. And told Scott and White, painted the picture that they're building a facility here in Marble Falls, and that it's just a good resource for the employees to use. But in the end, what we found when we did a geo access on the network, we found that the network is not sufficient for the employees here, because within a 25-mile radius of this zip code, you can see where Blue Cross Blue Shield comes in with primary care physicians, 117, Scott and White has 33, specialist physicians, 480 Blue Cross Blue Shield, and 91 Scott and White, and hospitals, there's 4 hospitals within a 25-mile radius, and the only Scott and White hospital right now is in Atlanta. And pharmacies, not too bad, 21 versus 14. But in the end, we just did not feel like that Scott and White was a good match for the employees here. Blue Cross Blue Shield is known in the state of Texas as having the broadest network in the state of Texas. And they're even coming out with a new network January 1 as part of healthcare reform. It's called the Blue Advantage HMO network. It's not available to your size group at this point, but it's going to have, they're going to have providers in all 254 counties under their HMO, and no carrier can even come close to that. So Blue Cross Blue Shield, we still feel like is the best fit. So with that in mind, what we did is we felt like we needed to tweak the medical plan offering to the employees of the city of Horseshoe Bay. And what we've done here is we worked through this. We looked at several different options. with Blue Cross Blue Shield, but in the end, what we said is, okay, if you look at this plan right here, the RMO2, that is the current plan that all the employees are on with the City of Horseshoe Bay that are covered by the medical plan. Has a $500 deductible. Once you meet the deductible, you pay 10%. The insured pays 10% of the next $20,000 to a maximum out-of-pocket deductible and co-insurance of $2,500. Then if they go to emergency room, it's a $100 copay plus deductible and co-insurance. Go to urgent care facility, $40. Office visit, $15, and prescriptions of $15, $30, $45. Drug card. So it's a very good plan, very rich plan, but that's the plan that's coming in at a 10% increase, with another 4% projected increase that's going to be added to those numbers as of January 1st for the reinsurance fee and the premium tax that's being added. All the other carriers have baked that into their rates, but Blue Cross Blue Shield is showing it as a separate line item and won't put it in their rates until it actually becomes effective, because it's supposed to be you're supposed to start paying that as of January 1st, 2014. And it kicks in, doesn't matter when your plan renewal is, that fee kicks in January 1st. Part of it is to go for subsidies in the exchanges or the marketplace, as they're now being called, and the other is to help subsidize the high cost of individual coverage, because individual health insurance in the state of Texas, as of January 1, is projected to go up anywhere between 70% to 115%, depending on which carrier you talk to. And Blue Cross Blue Shield controls 60% of the individual market in the state of Texas, and their rates are going up between 75 and 95% as of January 1st. So very fortunate that y'all are, this is an employee group, and you're not having to deal in the individual marketplace. So the other offering that we're looking at is another copay plan, and this is what we're saying that the premium payment should now be based upon, is this plan here, the employer premium payment. So this will be our base copay plan. It's still a $500 deductible. Instead of paying 10% of the next $20,000, an insured would pay 20% of the next $12,500 to get to a maximum out of pocket of $3,000. Still a very attractive plan, $2,500 max out of pocket versus a $3,000 max out of pocket. Same emergency room benefits, has a $45 copay for urgent care, $20 copay for a doctor's office visit, and then you can see the drug card, $20, $35, and $50. In addition to that, we feel like with the premium that is being spent by the city and potentially by the employees, that a third option needs to be in there, and that is an HSA compatible plan. The plan that we have zeroed in on with Blue Cross Blue Shield is a $3,000 deductible, has a 100% co-insurance as long as you stay in network. So the maximum out-of-pocket deductible and co-insurance is $3,000, and then everything else is subject to deductible. So if you go to the emergency room or to care, you go to the doctor, get a prescription filled, before you've met that deductible, the insured is going to pay that amount. They're not going to pay a copay. And so, but what we feel like needs to happen here is that some of the premium that the city would spend on this RMO4 plan, and you can see where the current spending is right here by plan, and this is the total premium. And then this is the total premium that would be under the RMO4 plan, but we're saying recommend the city base their funding based upon this plan, and then if an employee contributes or opts for the HSA plan, then the premium difference here, most of the premium difference that the city would be spending would go into the HSA, and we'll look at that in more detail in just a minute. But if the employee wants to buy up, they can buy up to the richer copay plan that they currently have. And this just gives you a cost comparison of where we are today. And if you look at where we are today, the total monthly premiums on all the plans, and this includes the employee contribution as well as the employer contribution, about $650,000 in total premium that's being paid. And then on the RMO4 plan, which is where we're recommending to go, the total monthly premiums would go from 54 up to 56, and then the total monthly would go from 648 to 675, and then this is that projected fee that Blue Cross Blue Shield will be adding as of January 1st, 2014, and it's roughly 2% for the reinsurance fee and roughly 2% for the premium tax. So the total premium, all inclusive, for the year of October 1st, 2013 through September 30th, 2014, will be $695,000, and that's an increase of 7.3%, 7.23%. If you just said, okay, well, let's just keep the current plan that we're on, and that would cause an increase of 13.3%. And we feel like that where we need to be is probably on this plan here, because this is a very rich plan, and employees of the City of Horseshoe Bay have enjoyed good benefits, and we're not backing off the benefits very much here just by going to keeping the deductible at $500, keeping the funding at 100% of the employee-only cost and 50% of the dependent premium, and their out-of-pocket is only going up $500. If we absorb the entire renewal that we originally got, these rates would be a lot higher. Anybody have any questions so far? Okay. So this shows what the City of Horseshoe Bay's contribution to premiums would be. And right now, this is what currently paying employee only, employee plus spouse, employee plus children, employee plus family. And the total premiums that the city is spending right now is $43,740 per month, and that is the employer's share of the premiums. We're recommending, instead of going all the way up to this plan, because what we've done here is we've shown you that the premiums that are spent here, the $543 for employee only, and the $881, the $813, and the $1151, that those same premiums be applied to the richer plan, the RMO2 plan, and so the city will pay the same regardless of which plan the employee's on and what level of coverage they have. And then here, the city's going to spend less in premium here, but we're recommending that the premium differential be spent on going into the employee's HSA. So if they do go to the doctor, do get a prescription filled, they've got some money set aside for that situation. And so this is what the annual cost would look like, taking all this into account. The current spending right now by the city is $524,882. And if the spending is on the RMO4 as opposed to the RMO2, you can see that the city will spend $45,000 a month, which comes out to $546,000, plus the ACA fees. And we're recommending that the city, in all this decision that we were looking at, that the city pay this $20,000 in fees instead of passing it along to the employees when it's received, the bill's received from Blue Cross Blue Shield for January 1. Because if we pass that along to the employees at that point, we've got to go back and have another open enrollment. And so in all the calculations, we just figured that in to what we're looking at. And this just gives you an idea of what it would look like to the city based upon the funding being on that RMO4 plan. And most of the increased cost to the city is going to be in the difference between the current spending on the medical plan and what's recommended on the RMO4. And the dental is only going up 3%. The life insurance and AD&D is not going up at all. So the net increase to the city is about $43,000 or 7.54%. Anybody have any questions? Y'all just mesmerized?
Are you through with your formal presentation?
there's just two more slides that just.
Once you finish up,
Okay.
then we'll have some questions.
Yeah, there's just two more slides. This shows what the employee payroll deductions will look like from where they currently are. You can see this is what an employee is currently spending for their share of the dependent costs on a per pay period. And if they're on the, if they go with the RMO 4, you can see that they're pretty close to where they are on the RMO 2. If they want to buy up, they'll pay this difference in premium going up to this plan. And then if they want to, if they go for the RMH 2, they would move down a premium. And our recommendation here is the employees, they're currently spending this much money, $162.23 per pay period. If they opt for this plan, our minimum contribution recommendation to them for the HSA is continue paying what you're currently paying. Just put the difference in your HSA if you go with that plan, so you're putting some money in there as well. We have some groups that are kind of matured in their HSA because we've had HSAs as of January 1st, 2014. It'll be 10 years that we've had HSAs. And we've got groups that have matured it over time that now if the employer is making an HSA contribution, they do it on a matching basis. They say if the employer put money in, we'll match up to a certain level. And but we think that the first year at least under this, that your employees, for the most part, are not going to have money to pay. Because when you go to the doctor, you're not going to pay one of those copays of $15 or $20. You may pay $100 to $150 to go to the doctor. If you get a prescription filled, you're not going to pay $20, $35, or $50 to get a prescription filled. There's prescriptions out there, as y'all probably well know, that cost $500, $600 a month to get filled. So they're going to run into some sticker shock there. And is the HSA plan ideal for everybody? Are the two copay options ideal for everybody? And the answer is no to that. That's why we're offering a triple option, and we think it's important with a group of 64 that we have options. I've got a group of 3 that has 3 medical plans because they all have different needs. They're all at different places in their lives. And so I think this is going to be a great opportunity for the employees. And this just gives you, shows the HSA contributions. And this is the monthly premium difference right here, $132.76 is the difference between what the city would be paying on the RMO 4 plan versus the RMH2. And we're recommending that a good portion of that goes into their HSA. This cuts back on a little bit of the premium, but what we're also doing, the HSA also has a monthly service charge that is charged to the employer. It's $3.95 an account. And probably what y'all see on there, we just found out they're going up as of October 1st. They charge the $3.95 per month for every account that has less than $1,500 right now. As of October 1st, it's going up to $2,500. And so that service charge will stay there every month that an employee has a balance of less than $2,500 in their HSA. Now these accounts all have service charges. The highest I've seen is $8 a month, but the bank that we're recommending to use is a bank called Health Equity, and all they do are HSAs. They're very, very good at it, very good with their communication tools, very good website, and it's easy for the employers to use. Frost Bank has HSAs, but I don't recommend our HSAs, and the bank knows we don't recommend them because there's no investment vehicles. With Health Equity, if you get more than $2,000 in your HSA, you can move some of the money over to mutual funds and invest in the stock market if you want to. So that will be an opportunity that the employees will have. So I think, so this is, just to give you an idea, with this funding on the HSA, if the city put in that $130 a month into an employee's HSA, it comes out to $1,560 a year. So an employee's net exposure under that plan, $3,000 deductible minus what the city's putting in, they're really exposed to $1,440 in expenses that they would have to come out of pocket. Under the copay plans, they're exposed to $3,000 of deductible and coinsurance. Under the RMO 4, plus copays, which is kind of an unknown expense, and then under the RMO2, it's $2,500 plus copays. But you can see even down here on a family of 4, or just a family, that there's 2 deductibles here, and there's 3 deductibles in coinsurance here. And so a family is exposed to $2,640 versus $9,000 plus copays and $7,500 plus copays. And like I said before, is this plan ideal for everybody? It's not. And but we feel like presenting the facts to the employees that we're going to get, I don't know what y'all are feeling, but I feel like we'll probably get 20 to 30 of the employees to participate in the HSA plans. Just simply for the fact that you have a lot of employees that you're spending premium on that hardly ever use the coverage. And I think those premium dollars would be better spent putting part of them into their HSA as opposed to putting it all into premium, because you have employees that have good years under the copay plan. Blue Cross Blue Shield, Aetna, Humana, they don't come back to your employees and say, here's some money back. But if you're under the HSA plan, you don't spend that money. It's in your account. And I think it's a very attractive option. And that's it.
Lee, thank you very much. Let me just ask a couple of real quick questions. What's the maximum amount of money that an individual and a family can contribute to an HSA account and get a tax deduction?
Okay, 2013, it's $3,250, and in 2000 for an individual, and sorry, I want to make sure I've got these numbers right. It's on the bottom of your presentation on that big spreadsheet. It's $3,250 for family, $3,250 for individual, $6,450 for family. And then anybody that's age 55 or older can contribute an extra $1,000. And then next year it's going up to $3,300, and for an individual, $6,550 for family.
Does a city contribution net against that?
Yes.
Okay, so that'd be the maximum.
Right.
Let me give you my take on at least what I would recommend to the city. And we're going to discuss this again, obviously, at 3 o'clock today, when hopefully we can make a decision on what to proceed. We've had a very rich plan. I think it's a rich plan by most everybody's experience. Nothing wrong with that. We could afford it. It probably helped us attract some employees. But when we're looking at a 14-15% increase this year, and maybe that's the trend for the future, it's probably time to look at our plan and say perhaps we ought to do something a little bit different. So the option of moving back to, I guess, I'm not sure which plan number it is, but to move back and say instead of a 90-10, it's an 80-20 situation. It's still, in my judgment, a generous plan. It's a reasonable plan, but it lowers the city's costs from, say, 14 to 7, which, in my opinion, is reasonable to the employees. I mean, we're saying there is a pretty significant cost increase built in, and we're willing to share it. But we cannot just continue to bear that cost ourselves. My bias is the HSA plan actually ought to make a lot of sense for a lot of our employees. And luckily, the way this process will work, the employees can bring their individual situations to Lynette, and to the extent they're willing to tell her, what their expense history has been. She could really give them some good advice. That information's confidential, so it'll be up to them as to how much they choose to share with her. But she's going to be skilled to help them evaluate whether or not an HSA might make sense for them or not. And for a lot of people, contributing the maximum, getting the maximum tax deduction is really advantageous.
Absolutely.
Tom had his hand up before I cut him off. So
Yeah,
go ahead.
thank you. Just a couple of questions about HSAs. There are maximums that you can put into an account. Is it a use it or lose it situation?
No, it's not. Whatever money's not used rolls from year to year. And I've been doing this. I've had an MSA, which was the forerunners to HSAs. I've had an MSA or an HSA for 14 years and had my family covered. And I looked at my statement the other day. I think I'm at $67,000 in my HSA. And I'm not telling you to brag. I'm just telling you that can happen, and it does happen. And the beauty of an HSA is HSAs were, when they originally started talking about them, they called them medical IRAs. And in the original discussions, and it's so people could put more money aside for retirement, because you get to retirement age, you've got two buckets of money. If you take it out of your retirement account to pay for anything, including medical expenses, you'll pay taxes on that. If you get to age 65 or older and you take money out of your HSA to pay medical expenses, it doesn't matter when you take it out. That's a qualified expense, and you won't pay any taxes on that. So that's the beauty of having an HSA alongside your retirement account.
I appreciate that, because I was struggling with the administrative fee if you had a use it or lose it situation, and after a certain threshold. What percentage of our employees, I assume maybe I said percent, do our employees have voluntary participation in healthcare plans?
They're all funded. We have exceptions to some of the police officers that retire from DPS and already have medical from there, so that'd be the one
So I was
exception.
just curious if we had employees that didn't participate in a health plan, didn't have a deduction, didn't pay into a plan. We do not.
That's correct.
We don't encourage that at all, but with some where it's obviously they've got a plan, it's clearly funded by somebody else. And in, I think, many cases, we reimburse them something for the money the city saved by not having to pay their health care.
Thank you.
Well, I appreciate the presentation, Lee, and I would encourage us to consider funding the difference in the RMH2 to the basic RMO4, whatever it is, that $132, and to help fund the initial cost that the employee will have, for at least the first year, and then not commit to anything beyond that. But that would at least set up kind of a 50-50 basis, as you mentioned, of participating in that, and it won't cost us any more than it would if they were joining the whatever it is, the RMO4.
Right.
Right, if all the employees opted for an HSA account, for the first year, our costs would go up 7%. For the second year, the city council could have a choice as to how much of that HSA contribution you chose to fund.
I think the second year would probably be an attractive point to look at, maybe matching. If you participate, whatever up to this level, we'll contribute up to this level. So, but I think it's important the first year to get some money in those accounts for the employees, because they're going to have some sticker shock.
It's going to be a sticker shock, but also I think we should encourage them to consider that. And this would be helping to encourage them, because it is a nice plan. David and I were talking earlier, wish it had been available when we were at that stage. So,
When I retired, I didn't have 67. I had an HSA for 10 or 15 years. I didn't have quite that much, but I surely had a significant amount of money. And when you're covered by Medicare, it's a little bit hard to spend it. And legally, you can use that money to fund the Medicare premiums that you have to pay. So it doesn't just get locked up forever. I mean, you can. There are ways to spend it. So it's a very good plan.
You can also use it for long-term care too.
Yeah, that's right. Yeah.
Lee, can you add one thing and tell them about how they can use this money in HSA for stuff that those plans don't cover, and for dental and vision? Expand on that.
Yeah, there's a list of expenses. They're called 413D, and if anybody's ever been on an FSA, it's the same list. It's publication 502, and but there's items like acupuncture, LASIK eye surgery, several things. You can even use it to pay for dental expenses, vision expenses. That's things not covered by the medical plan. And so it gives the employee a lot of flexibility. And also, too, if they have a dependent that is not maybe covered by their medical plan, as long as they're claimed on their tax return as a dependent on their tax return, they can use the money in their HSA to pay their medical expenses as well. So it gives an individual a lot of flexibility. And also too, the other thing it's going to give us is, this deductible of $3,000 over a period of time, if people get more money in their account, we may be able to raise that up some too, because we're going to see deductibles, we're going to see maximum out of pockets in 2014 when the group renews. Maximum out of pocket for your group is going to be $6,350 for an individual, $12,700 for family, and that's going to be as required by the Affordable Care Act. And so it doesn't matter where you are; that's going to be the maximum limits. But you're going to see some HSA plans that have a $6,350, and so we'll keep moving up on that, and it just gives us an opportunity to save some premium.
Okay, well, we got a chance to think about this between, now and 3 o'clock, but definitely the proposal, I mean, obviously we won't go in here this depth this afternoon, but it will be the 3 plans, and as Steve mentioned, with the city supplementing the funding to the HSA to the extent of the premium savings to the city.
And the booklets that you have all the backup from all the other carriers, the other bids we received from other carriers, just so you know how we got to the point where we are. And that booklet that you're looking at there, is the one that I believe that's the one we talked to the city off of employees last Friday.
This is the one that went out on that y'all did at the safety meeting, right?
Correct.
Lee, thank you very, very much. Appreciate the presentation and
You trees.
more important to work over the last few months. I think it had a good result.
Thank you.
Thank you. At least I'm gonna make a, okay, we're off the record.